It's hard to imagine in this day and age many companies lasting for 60 years, much less a medical clinic. I think that Drs. Kelsey and Seybold both had quite a vision and quite a futuristic view of medicine at the time when they started this 60 years ago. So I think it's an interesting phenomenon to kind of watch and be a part of, especially for the last 15 years, but also because Kelsey-Seybold is what brought my parents to Houston in 1965. So we've actually been a part of the Kelsey-Seybold family since 1965.
Well, I think it's quite an accomplishment for us to have been in business this long and serving patients in the Houston area that long. And obviously the clinic has grown and matured over those years into just a fantastic place to work.
We've grown where we were wanted. There were communities that said, you know, come and take care of us. I mean, what we did, it's a really neat thing, a neat concept, is we tried to take medical center quality doctors and put them in bedroom areas of the city. And I've enjoyed watching that grow, and it has flourished. In fact, I think one of the reasons that we're successful today, whenever some of the other multi-specialty groups have not been successful, is we've tried to get where people wanted us to be in the community.
We go back a ways, half the time period of the 60 years, but I've been fortunate enough to see the quality care that is delivered at Kelsey-Seybold Clinic by our physicians, by our nurses who also deliver tender loving care. And I am also happy to know that our patients appreciate the love and care that they get at Kelsey-Seybold Clinic.
When I think of Kelsey-Seybold and its 60-year history, it's clear that we've got staying power, which is really quite extraordinary in healthcare these days.
With all the discussion about healthcare reform right now, I mean, right now I feel a real sense of pride being part of this organization. I mean, we've been getting it right since our inception. Multi-specialty clinic, strong emphasis on primary care, practicing evidence-based medicine. One chart, now we moved to EMR. I mean, we're doing a lot of things that the rest of the country could look at us and emulate. So I feel very proud to be part of an organization like ours.
Well, I think what comes to mind probably more than anything is that in the 15 years I've been at Kelsey, we've seen a lot of changes in this ever-changing healthcare environment. It's something we just had to adapt to. The one thing that has remained constant has been the dedication and commitment of our physicians.
Well, I think they like the idea that we have multiple locations and that we have quality people at these locations. We're convenient, we're accessible, and we have the infrastructure of the tertiary referral where we can deal with our own cardiologists or deal with our own gastroenterologists and have a much more personal relationship without just sending them out to somebody else and someplace else.
Well, I think it's definitely the caring atmosphere, and that happens from the front desk, especially the nurses, certainly the physicians, all of those in administration. We put the patient first, and obviously patient care is our prime directive.
I would have to say kindness, because it doesn't take a lot of time to deliver kindness, and it doesn't take a lot of time to say what you have to say if you say it in a kind way. And the person receiving the kindness will always be grateful and always want to come back.
You have medicine in many areas offered in one location or within one area, one building. I think that it is convenient for patients. They can have their doctor's visits, they can do any of their ancillary testing all in one place without having to go to several different locations or several different places to get care.
I think our patients have maintained that strong bond with our physicians, and I mean, I think that's special. I mean, I think they appreciate the fact that they're able to come to one clinic and pretty much get everything done, but I don't think that they feel like they're part of a number at Kelsey. I think that they maintain that strong bond with our physicians, and I mean, I think that's pretty unique.
I think we have the very best people, and I don't mean just the doctors, but I think all the staff from top to bottom. And that's what has been the key to the Kelsey-Seybold success, is the quality of the people, their dedication to what we're doing, and making the clinic to be the best that we possibly can. There have been some very important events in my life at Kelsey that Dr. Kelsey has
participated in, and that has been a real source of pride to me. When we opened our clinic at Fort Bend Medical Diagnostic Center, Dr. Kelsey was in attendance, and I got to speak with him for a few minutes at that time, and it was a real honor.
And I remember we left the clinic one evening together, and he put his hand on my shoulder as we left the back door of the West office going in the parking lot, and he said, "Jim, I just want you to know how much I appreciate what you and the other pediatricians have done to make the clinic successful this year." And it was sort of an affirmation that, you know, taking care of young people, taking care of kids was an important thing in the life of Kelsey.
Dr. Kelsey is an inspiration to many of us, especially the physicians and the other leaders of the clinic. He not only started the clinic, but he was also an excellent physician and strove to give the best care to his patients, but also run an organization over all these years.
That's probably easier for me to answer than most. Had it not been for Dr. Kelsey co-founding the clinic, I would have never met my wife, who's an ex-Kelsey employee, and we wouldn't have never been blessed with the children that we have.
Mavis truly has been the epitome of the practicing physician. He is very patient conscious. He knows how to deal with people. He knows how to stay out of arguments with patients. This is one of the things he taught me. You know, he said, never ever argue with a patient about anything, and his good advice.
Dr. Kelsey is a man of vision, and I admire men of vision. And at the same time, I can only say that I'm grateful for his vision that has had such an impact in my personal life, because I've had a job which has been something of a blessing for me and for my family, and because he has contributed to the whole Houston community in a way that has been so special, and to so many others whose lives have been touched by his vision.
Well, I think what happens next for Kelsey-Seybold is that we stay true to our knitting, that what has worked for 60 years are core fundamental values that are likely to continue to work into the future. And that is continue to attract the best doctors that we possibly can, coordinating them together with a single system of care dedicated to the purpose of serving our patients to the best that we can, delivering the best medical care, the best clinical outcomes for a price that patients can afford and find attractive.